The reality is that every heroin overdose death is a preventable death, because all that needs to happen is that somebody is there, recognises what's going on and intervenes. It's actually pretty easy to save somebody's life if you're there and you have the tools at your disposal to either breathe for them or give them an antidote, which is Narcan. So it's that simple. If somebody is there, sitting beside, supervising or bearing witness, whatever terms you like to use, nobody needs to die. And yet all around this wonderful state of ours, we provide 13 million needles every year, knowingly to people who inject drugs, with the full support of government in order to prevent an epidemic of HIV, and yet we then tell them to go away. So the difference with our service is we just say, hey, stay here, do it where we can make sure you're safe, the community is safe, and start having a conversation and a connection with you about what other alternatives are possible. There's no legal issue about the operation of this service. We have a specific Drug Misuse and Trafficking Act amendment which allows us to operate, but literally all we do is provide the clean injecting equipment, which has been going on under successive governments for 35 years, and we provide a roof and some wraparound care and support services from the nurses and counsellors who work there. Nobody has ever died, not only in our service but in any supervised injecting facility elsewhere. And so, yes, you're right, it is a controversial and an emotive topic. I get that. But like anything, when we approach it with a pragmatic, sensible response based in health evidence, much like we've done with the COVID crisis, when you respond in a proportionate way with evidence behind you, you can make a difference. That's what we've done. I find it disappointing that 20 years later we are still the only one in the state.
There's evidence and there's the science and then there's the real people on the ground that you're dealing with every day, Doctor. So can you tell us a bit about the impact that the centre has had on drug use, particularly in the area there around King's Cross?
So our job is not to magically make drug use go away. It'd be great if we knew how to do that. We don't. And the way I kind of make the analogy is if somebody goes to an emergency department and is treated for a heart attack, then somebody says, oh, have you fixed their diet and their obesity and their diabetes? Like, well, no, the emergency department deals with the heart attack, and other parts of the health system deal with other aspects of the health and the more longer term things. So we need the whole of our health system in order to treat addiction and other drug related issues as a health issue. Our job is to keep people alive and then form that link to get them into the treatment services, the care and support services, the health services, the mental health services. So what we can do is provide a bit of a safety net, if you like. And you know, it's extraordinary to think that there has never been somebody die, and some of those people are still coming back and seeing us. We had somebody that spoke at our anniversary event at St Stephen's Church today, and you know, he can look everybody in the eye in the audience and say, look, I wouldn't be here. I wouldn't be here today talking about my story and how I'm now 2 years without using any drugs if it wasn't for the Injecting Centre. And that's powerful, really powerful.
A safety net that you've been providing for 2 decades now. You've come this far, advocating for a health-focused approach rather than a criminal one, which is very important. What more needs to be done? Can you take us through the next steps?
Well, we came out of the 1999 Drug Summit, and there was an incredible amount of wonderful policy initiatives that came out of that. There's some unfinished business, and that was about removing criminal sanctions for possession of small quantities of drug use. And I know there are many people in government today who support that as well. It really is about being sensible and taking our heads out of the sand and acknowledging the world as it is, and being pragmatic and evidence-focused, because we can keep people safe, we can reduce the stigma, and if we increase investment in treatment, then we can really start to shift this debate.